Hi, my name is Nigel Brockton. I'm the Vice President of Research at the American Institute for Cancer Research. Breast cancer is one of the most common cancers in American women. And the question we often get is, how can we reduce our risk? Because people are exposed to lots of news items and advice, particularly around breast cancer, because it is so common. And AICR has spent the last 30 years analyzing the evidence to really define what are the strongest factors and what do we have the most confidence in the advice that we can give. So the first one is to maintain a healthy body weight. We know that a higher body weight increases your risk of postmenopausal breast cancer. And mechanisms for this are potentially via sex hormones, estrogen, particularly inflammation and metabolic changes. The next factor that we know is physical activity. Being physically active reduces your risk of both pre- and postmenopausal breast cancer risk. So that's why our second recommendation is be physically active, make physical activity part of your everyday. Another factor for breast cancer is alcohol. Any degree of alcohol consumption increases your risk of breast cancer. So we recommend not drinking, and that if you are going to drink, you should certainly stick within the national guidelines, which is 1 drink per day for women. The final factor is it's a small decreased risk, but if you do breastfeed, you do reduce your risk of breast cancer and actually decrease the risk of overweight, weight gain, and obesity in the offspring. So although it's a small factor, it's beneficial for both the mother and baby. So those are the 4 factors that we have really very strong evidence for. And if you're going to put your energy into any particular factors, those are the ones that you should really focus on and try and filter out the noise.